This video is based on a presentation developed by the National Osteoporosis Foundation to increase awareness of bone health and osteoporosis. The NOF is the nation's leading health organization solely dedicated to osteoporosis and bone health. What does strong mean to you? Strong bones are very important. Do you have an active lifestyle? Do you enjoy traveling? For these reasons, and many more, strong bones are important. When you think about staying healthy, you probably think about ways to prevent conditions like cancer and heart disease. Keeping your bones healthy may not be at the top of your wellness list, but it should be, and here's why. Osteoporosis is a disease that causes bones to become weak and break more easily. About half of all women older than 50 and 1 in 4 men will break bone due to osteoporosis at some point of their life. In terms of the University of Arkansas, approximately 6,000 women and 3,000 men are at risk at some point in their life for osteoporosis. Today we will talk about if you're at risk, preventing bone loss, and diagnosing osteoporosis. Bones are actually living and growing tissue. Throughout your life, your body breaks down and removes old bone. At the same time, your body makes new bone. Children and teenagers make new bone faster than they break down old bone. This means their bones get denser and denser until they reach what experts call peak bone mass. This usually happens between the ages of 18 and 25. Improving bone health can happen at any age, although it is important to grow and build strong, healthy bones when you're younger. Younger people with lower bone densities will have less bone to lose when they're older. Lower bone mass increases the chance of getting osteoporosis. As you grow older, you may begin to lose more bone than you form. Because of menopause, this happens more rapidly in women than in men. The onset of osteoporosis happens when you lose too much bone and make too little bone. The word osteoporosis means porous bone. If you look at bone under a microscope, you would see that parts of it look like a honeycomb. If you have osteoporosis, the holes and spaces in the honeycomb are much bigger than they are in healthy bone. This means your bones have lost density or mass. Note the differences between the picture of normal bone on the left and the picture of bone with osteoporosis on the right. Osteoporosis is a condition where the bones become weak and can break from a minor fall, or simply a sneeze, or even bumping into furniture. In addition, broken bones in the spine can cause height loss and kyphosis. You may not realize you have osteoporosis until you break a bone. The most common breaks happen in the spine, hip, and wrist, but many other bones can be affected. These breaks are also called fractures. But keep in mind that you are never too young or never too old to take steps to protect your bones. Did you know a man older than 50 is more likely to break a bone due to osteoporosis than he is to get prostate cancer? Also, a woman's risk of breaking a hip due to osteoporosis is equal to her combined risk of breast, ovarian, and uterine cancer. Osteoporosis is far more common in older people than younger people. If you have a family history of osteoporosis or broke a bone as an adult, you are more likely to get the disease. Osteoporosis affects all races and ethnicities. However, Caucasians, Asian Americans, and Latinos are much more likely to get the disease than African Americans. Women and men who are thin or have small bones are more likely to get osteoporosis. There are several risk factors that you can change, though. Some of these include eliminating a poor diet. It is important to have a healthy diet that is rich in fruits and vegetables. You also need to get enough calcium and vitamin D. Another risk factor that you can change is lack of exercise. For healthy bones, you should try to exercise for about 30 minutes on most days. And finally, don't smoke and don't drink too much. Drinking 3 or more alcoholic beverages a day can harm your bones. The chemicals in cigarettes are harmful for your bone cells. Smoking also may make it harder to absorb calcium. For women who are smoking, smoking can prevent estrogen levels from protecting your bones. Regardless of whatever age you are, the recipe for bone health is simple for both men and women. First, get enough calcium and vitamin D in your daily diet. Second, exercise regularly. Third, make healthy lifestyle choices. And finally, talk to your healthcare provider about your bone health. Your body needs vitamin D to absorb calcium. Vitamin D also helps your body make new bone and keep your bones healthy. Vitamin D is also added to milk and some other foods. Yogurt and milk are examples of foods that are enriched with vitamin D. You know that your muscles get bigger and stronger when you use them. Your bones are similar. They get stronger and denser when you make them work. The two types of exercises that are important for keeping bones strong are weight-bearing and muscle strengthening exercises. Weight-bearing exercises include activities that make you move against gravity, such as walking, jogging, and elliptical training. When you do muscle strengthening exercises, you move a weight or your body against gravity. Muscle strengthening exercises include lifting weights. What women need to know. Low estrogen levels lead to bone loss. Also, women can lose up to 20% of their bone density in the 5 to 7 years after menopause. While many tests are used to look at bones, the bone mineral density test is the only one that can diagnose osteoporosis. Experts recommend a type of BMD test of the hip or spine using a machine called a central DEXA. This is the machine you see in the picture. The results of your BMD test will tell you your bone density. Low bone density is also called osteopenia. While osteopenia is not a disease, it is the medical term for bone density that is low, but not low enough to be considered osteoporosis. If you're told you have osteopenia, it does not always mean that you're losing bone or will get osteoporosis in the future. However, if you lose too much bone in the future, you will have a greater chance of getting osteoporosis. The NOF recommends BMD testing for the following people: all women above age 65 and all men above age 70. While there's no cure for osteoporosis, there are steps you can take to slow or stop its progress. In some cases, your bones may even improve. The FDA has approved several medications to prevent and treat osteoporosis in men and women. Just remember, follow these guidelines and be proactive. Osteoporosis is preventable and also treatable. If you have any further questions about this presentation, please feel free to contact Dr. Michelle Gray of the Human Performance Lab at the University of Arkansas.